The typical American dedicates a significant portion of their annual budget to healthcare expenses, with healthcare spending surpassing $8 trillion, constituting nearly 20% of the GDP. It's evident that healthcare costs in the U.S. are approximately double those of other developed nations. The complexity of the U.S. healthcare system is primarily driven by market forces, resulting in significant costs. Let's examine three key factors contributing to the failure to deliver adequate healthcare at affordable prices in the U.S. On average, Americans spend nearly double the amount on pharmaceutical drugs compared to individuals in other industrialized nations. Certain individuals are covered by government-run programs like Medicare, where the government aids in negotiating prices downward. Meanwhile, those covered by private insurance are left to navigate pricing independently. This disparity contributes to the elevated medication costs in the U.S. With minimal pricing regulation, the average American spends around $900 on prescription drugs, significantly higher than the average of $400 spent by individuals in other prosperous countries. Another significant factor contributing to the elevated health insurance costs in the U.S. is the practice of defensive medicine. Physicians fear malpractice lawsuits, leading them to order multiple tests even when they are confident about the diagnosis. According to a Gallup survey, approximately $650 billion per year is attributed to defensive medicine. This cost burden is shared by everyone through increased insurance premiums, copays, out-of-pocket expenses, and taxes that fund governmental healthcare programs. In a 2015 analysis conducted by the Commonwealth Fund, administrative costs comprised 25% of total U.S. hospital spending. This percentage is more than 3 times higher than that of Canada and the highest among 8 nations examined. In contrast to countries with nationalized health systems, the billing departments in the U.S. are significantly larger. Here, healthcare providers must negotiate payment rates individually with each payer and manage various requirements and billing procedures. In many cases, hospitals employ more billing specialists than they have patient beds. It is often said, "An ounce of prevention is worth a pound of cure." And this saying holds more truth today than ever before. Frequently, health issues stem from lifestyle choices, which can significantly impact healthcare costs worldwide. Painful as it may be to acknowledge, poor diet and inadequate exercise are major contributors to many of the most expensive health problems, such as cancer and diabetes. Prioritizing fitness not only benefits your finances, but also enhances overall happiness and reduces the likelihood of visits to hospitals and doctors' offices.